Well, welcome everyone. We're so excited to have our first workshop after a really great annual gathering weekend. I know that we're all glad. We have about 27 people right now. There still could be a few more folks joining us. But before we get started and talk about what the next hour will look like, I'm going to pass over to Sarah George, who you've heard from this weekend, to talk just a little bit about some of the technology um, things for this week or for tonight. Sorry, my dogs are being a little crazy.
Thanks, Allison, and thank you so much for working so hard to schedule this session. We're really excited about this. Just a couple of tech notes to go over with all of you. There may be an option for asking questions to the panelists later on in this session, and the chat box is how we'll start that off. So if you have questions, go ahead and ask them, and you can feel free to send those to everyone, and then we might call on some folks to either unmute themselves or ask their question, or depending on time, the facilitator Allison might read those out. And then just a couple of notes about respectfulness. We are all here to learn, and we've got some excellent panelists joining us for this awesome session. So we do invite you to come with an open mind, come with an open heart, and come with that spirit of listening and learning at this session. If you're making comments or asking questions of the panelists or of one another, we ask that you make sure all of your comments are constructive and positive, and not intentionally hurtful in any way. So maybe we could all just give a physical thumbs up to kind of consent to those ground rules of etiquette and respect on this session. Excellent. I think that's all I've got.
Well, again, welcome everyone to our first panel, the experiences in healthcare, mental health care, and ministry during the COVID-19 pandemic. We have four great panelists. We have Dr. Sharon Colton, Father Jagela, Brian DeRouen, and Wendy Tuck, all with lots of different CCA experience, Catholic worker, influences in why they've chosen to do what they've done, as well as different ministries and work, which are really important to the most vulnerable in our communities. And so I'm going to pass that over, and we'll allow each of them to first introduce themselves, talk a little bit about their work in ministry, where they're located, and then we will move into some more guided questions for each of them to answer. And then at the end, if you have questions, you can feel free to ask that. And if a question comes to you while they're talking, feel free to share it in the chat box right away. We might not get to it for a little bit, but at least that way you won't forget. So let's go ahead and pass it on over to Dr. Sharon Colton.
Okay, hi. I'm glad to be here and glad to tell you a little bit about what I do and what I love. I've been a family physician here at the Cloverfork Clinic in Everett, Kentucky for the last 26 years. Everett's is located about 9 miles north of Harlan in Harlan County, southeastern Kentucky. That's our primary clinic. We have a satellite clinic for the last 12 years also right in Harlan, so we have two clinics. We're celebrating our 50th anniversary this year, just like CCA, so we're pretty excited about that, although we could not have a big celebration. But my history goes back to 1973 when I was recruited by Appalachian Regional Hospitals from Marquette University as a medical lab technologist. I started out in the laboratory at the Whitesburg ARH Hospital in 1973. And that's when I first got connected with CCA. It would have been actually my first meeting, I think, was in 1975. There was a Servite sister at the time who was helping with our CCD, and I met her and got connected with her, and through her, the David School and Bill Poole in Prestonsburg, met all those folks and got connected with CCA. And so other than the time that I went away to school again, I've been in and out of CCA for a long time, and it's just been a wonderful journey. But in the 80s, I decided to go back to medical school. It was something I'd thought about as a child, but didn't think I was smart enough. So I did go back to school in 1987 and to the University of Louisville, and then did my residency at the University of Missouri in Columbia. and came here in 1973 to the Cloverfork Clinic. You know, I had already fallen in love with the mountains, you know, before I left for school. And people kept saying, oh, especially if I did my residency out of the state, that I wouldn't be back. And I said, oh, yeah, I'll be back. And Cloverfork seemed like the best fit for me at the time. And it's really a really good place. It's an independent, nonprofit rural health clinic. We're hoping to become a federally qualified health center, but we're just a lookalike now. Don't ask me to explain that. You know, the people here are just so wonderful and so friendly and so loving and so trusting. You know, it's just a real joy that when you're able to help somebody, you know, when you get that diabetic who comes back and their sugars are doing better and you can both get so excited about it. You know, there's just a lot of joy in being able to do that. And there's plenty of challenges as well. No question about it. You know, when you're living in an area that's so poverty stricken, and right now, especially now with the loss of the coal mining and everything, you know, it's very difficult. Even when patients have Medicaid, which is like the gold car of healthcare, well, that's great. But if they can't get to Harlan and have the gas to go to their physical therapy in Harlan, or if they can't go to the hospital to get the CT scan they need, if they can't, you know, even make it into your clinic, you know, to get things that they need, it's very difficult. And there's the lack of a lot of ancillary services, you know, like the only dietitian in the county is at the hospital, and she doesn't have time to do, you know, much, education in that. One thing that the pandemic has sort of helped is that we have a little bit better behavioral health now, because the providers who are doing things over video now has just really exploded. I'd say 2 years ago, we just didn't have those options. We only had the local mental health, and people didn't want to go there because, you know, I'm not crazy. So with COVID in particular, you know, lots of fear. I think one of the biggest thing has been just the uncertainty, both on our part, not knowing, you know, what are the facts? What do we need to tell people? People are begging us for what does this test mean? What should I do? What does it mean? And, you know, what it meant back in March and in May is totally different than what it means now. I'm thinking of a situation, one of our first really serious ill patients was a husband and wife. They came into the clinic. We sent them directly to the hospital. The gentleman was sent to UK, and he ultimately died. The wife recovered but went home under quarantine. So here she'd lost her husband. She was scared to death that she was going to infect her family. And so we have a PA, a physician assistant, who was her primary care, and he was going to her house to retest her every 2 weeks. You know, he would bring the full protective equipment and would go to her house and test her, and she kept turning up positive. Well, it wasn't until I think August 14th that the CDC finally came out with a guidelines that, oh yeah, don't test them because they're going to stay positive. They're going to stay positive anyway, but they're not infectious. Well, we didn't know that, and she didn't know that. So here she was all by herself in her house, who just lost her husband. I mean, it was horrible. And, so things change. And finally, and even when we got to the point where now they're saying that 10 days after you're positive, if you are symptom-free and fever-free without any medications for 24 hours, you're released. So things are changing all the time. And so that's really difficult. And the isolation of our elderly, that's been really difficult. But anyway, we can go into more detail later. But so many problems, as most of you who live in the Appalachian area know, problems with drug, lack of access, how much that your grandparents taking care of their grandchildren because their kids have problems with drugs. Just so many things, and just magnified by COVID. It's a challenge for sure.
Thank you so much for sharing. We'll definitely get into that a little bit more. Father Walt, would you like to share next?
Sure, thank you. Certainly, first and foremost, I just want to thank CCA for inviting me into this session and being able to speak. And I'm Walt Jagela. I've been a priest in the diocese here of Wheeling, Charleston, West Virginia for 26 years. Some days it seems like forever, but 26. is the official number, with a few little, hits and misses along the way. I'm presently the pastor of All Saints Church here in Bridgeport, West Virginia. I came here right at the very beginning. I was assigned here right at the very beginning of the pandemic. So that was very much a challenge for myself, coming to a place that was relatively totally empty. The staff was away. We've closed our buildings. I only met very few people that were here. But prior to coming here, I've always been very much a social justice individual. So much so that I remember writing a paper. Some may find this kind of humorous. I know I do. I wrote a paper in the seminary, and it was detailing all of the different social justice teachings of the church. And, I read some different articles and books and papers, and I put it all together in my own words, and I handed it in. And the professor, who was a priest, kind of an old crotchety kind of guy, and he didn't hand my paper back. So he asked me to come to his office, and I went to his office. And when I went to his office, he handed me my paper, and he says, "These are not your words. This is not what you believe." I was like, "Excuse me?" And so right then and there, I knew that, social justice was something that I think that is very near and dear to my heart. The poor, the disenfranchised, really everything that certainly we believe in as Christians in general, and CCA, but also what Francis, Holy Father Francis has been, working towards, and, taking people on the margins of society and bringing them in and welcoming them and embracing them. And I hope and pray that, my own ministry has and continues to be that. Certainly the pandemic, I know I'm very much an extrovert. That might be shocking for some of you that are on this on this live cast here this evening. But I'm such an extrovert, and so when I came here and everything was shut down, friends of mine would call me, and they're like, "Are you okay, Walt? Are you okay, Walt?" And I'm like, "What are you talking about?" "Yeah, I'm fine. I'm unpacking my things. I'm putting, pictures on the walls." And they go, "Well, we're just checking on you because we know that you are an extrovert, and this is probably killing you because all the restaurants were closed. Everything that is, anything that dealt with being social was pretty much, set aside." But what I believe that this has taught me personally is to go within during this pandemic, and to really listen to what, my heart, what God and God's wisdom is speaking to me, on a personal level, and then allow that to go out to the masses of people. And so what I did is I went to, Facebook, and reached out to my own parishioners. And not just my own parishioners, but even former parishioners. Mary Ellen, I know you're on there, so I say hello to you. And your friend, I'm not sure who it is, but I say hello because it's probably a friend of mine as well. But reaching out to, parishioners and people, just with words of encouragement, and not to, in a sense, fear this virus, this pandemic, but to give people comfort, and to let's follow, yes, all of the protocols, everything that we need to do, but not allow, and to be very safe, but not to allow it to really run our lives. I think what I found here once we were, and I will say it, I think I'm very safe in saying this, and that the most vulnerable are the ones who continue to come to church. When we were forced to open our doors, to resume in-person Sunday Mass. We just had little trickles of people coming, and I told people then, and I continue to tell people, with patience and time, we will obtain everything we want. Everything we want. Everyone wants, I always hear people, even now, Sunday after Sunday, people want to rip off that mask and, I can't wait to get rid of this. And patience, paciencia, patience. Patience will obtain everything for us. I could go on, but I will leave it at that for now.
Great, thank you again. And just a quick interjection, we are recording this session, so if for some reason you don't want your face to be given out, you can go ahead and turn your video off, but otherwise we're recording it for those who couldn't be here but still are interested in watching it later. We'll go on over to Brian.
Well, greetings from Alderson, West Virginia, everybody. It's fun hearing different stories about arriving in Appalachia or whatnot. I am a San Francisco Bay Area boy. That's where I grew up, and I absolutely adore my Northern California. And I just happened to fall in love with a woman who had a love for Appalachia. She went to Xavier University and volunteered with CAP at Camp Andrew Jackson down in Kentucky. And after we finished grad school and we were kind of working at the University of Dayton, we decided we wanted to try something different. We'd both lived in urban and suburban situations, but had never lived in a rural situation before. So we had a pet pig at the time. This was before we had any human children, and we were looking around for an intentional community that would accept both Kathleen and I and Larry, our potbelly pig. Shockingly, every community is not in the market for a jerk potbelly pig. Larry has a biting issue. He's not the nicest pig around. But we love him. And Bethlehem Farm invited us to come and visit. And I still had my West Coast ideas about Appalachia and what she is and what she isn't, and whether I could be happy long-term in ministry in Appalachia. And so, but on the first time when we went to visit Bethlehem Farm, sitting up on the bedside stand when we first got there that first night, was At Home in the Web of Life, or This Land is Home to Me, or one of the double features or whatnot. And I read it and I was like, now this I can get. This is both a faith and a church and a region and a people and struggles that I can dive into and feel very much at home in, despite the many differences between an Alderson, West Virginia, and a San Francisco Bay Area. So Kathleen and I and our little boys have been running the Alderson Hospitality House for a little over 10 years now, coming up on 11 years, because we moved in on Micah's first birthday, and he's going to turn 12 in October. The Hospitality House is a nonprofit bed and breakfast for friends and family of women incarcerated at the federal prison camp here in Alderson. And during our decade at the Hospitality House, we've had some adventures. The house we lived in was destroyed in a flood in 2016. The roof was ripped off of the Hospitality House in a derecho a few years before that. So life can be a bit of an adventure here in this river town that seems to have 1,000 or 500-year floods every 5 or 6 years these days. But nothing has changed life at the Hospitality House in an unforeseen way as this pandemic has. Visitation has been suspended by the Bureau of Prisons since March. So whereas we are accustomed to having 40 to 50 people at our house every Friday and Saturday night, and some people here on Thursday and some people here on Sunday, all those visits have stopped. Unlike Father, who spoke about his extroversion, my wife and I are both very social people who are both incredibly introverted. And so sometimes we're like, good Lord, how did we fall into a vocation that involves talking to this many people all the time. So I would actually be lying if I didn't say part of this pandemic has been recharging. As Father said, we can turn in, right? We can turn into our family. We can turn in to quiet in a house with 13 bedrooms and whatnot. But the flip side of that is a ton of our ministry has switched on to telephones. Usually in the past, what we did on telephone was make reservations, right? And answer a few questions. Oftentimes parents would call us before their loved one is going, their daughter, for example, is going into the prison to ask questions about it. But those phone calls, most of our ministry and the conversations that we did were in person. We're across the dinner table while I was cleaning bathrooms, while just doing the work of a bed and breakfast. We haven't closed during this time because there are still women that are having to turn themselves in to begin their prison sentences, and there's families picking up their loved ones after months or years or even decades of incarceration. It's been interesting because the things we provide on paper, meals, a warm bed, a comfortable room, all that, those are really the excuses to get people in so that we can love them and so that we can recognize Christ in them and so that we can foster communication between them, right? My job on a Sunday afternoon usually is to sit and watch football all day because, guys come down to watch football. Sometimes ladies come down to watch football. Even the ones that stay up in their rooms and don't really want to talk to anybody else, but folks will come together to watch sports on TV and folks will come together to eat. And so we intentionally don't have TVs in each room. So if you want to watch the games on Sunday, you have to come down. And so we'll start out talking about if the Bears are any good or whatnot, but then pretty soon we're talking about, hey, how are you keeping your marriage together after your wife's been incarcerated 7 years? Hey, how are you teaching, your tween daughter about menstruation and about pads and all that kind of stuff? As dad, you were expecting mom to be covering that territory, but mom's been locked up for a long time. And then once we have the first conversation, then it's very rare that people stay up in their rooms because they see what they were actually needing was far more than a bed to sleep in. They were needing somebody who didn't really care that their wife, daughter, grandma, sister were incarcerated and wanted to hear how wonderful they are and wanted to hear stories about them. And yes, wanted to hear about the case, just wanted to hear anything that the people had to say. Oftentimes we give a space for people to be angry because there's a lot of husbands. There's definitely a lot of angry mother-in-laws that stay with us. They did not think their son-in-law signed up for this. But fortunately, their sons disagreed and are still in it, right, as their wife is going through this incarceration. We're not able to do any of that in person right now. The health department is allowing us to be open, but we're literally not supposed to be in the house when there are guests in the house. So, for example, we have a guest that is picking up tomorrow who has been visiting our house at least once a month for 8 years now. And it's a trip for us to, normally we'd give her a hug. We'd spend all night talking to her tonight, right? But tomorrow she'll leave at 7:45 and we'll go out to the driveway to wave goodbye. And that's really different than what we're used to doing. And clearly, the emotion comes out because any struggles that I have are next to nothing compared to what these families are struggling, because a prison is pretty much the worst place you could possibly want to be when there's a pandemic. Hospitals are scary, but hospitals are meant to heal people. There's nothing healing about prisons. There's no access to health care. So fortunately, the virus has not gotten into FPC Alderson in any dramatic way as it has to so many other prisons. But the prison has very much locked down in its giving out information. And it's very arbitrary who gets released to home confinement as opposed to who is having to stay there. And so we just have a lot of very scared families calling and talking to us. And we have a lot of guests who have become family to us, who visit every week, who haven't been able to visit their wife or loved one since March. And they're very limited in either the money they have for phone calls or the access to the, what portion of those 300 minutes that they have. And so a lot of those phone calls are coming to us. And so it's wonderful that we are still able to have an active ministry, but it definitely feels very different than it ever has at the Hospitality House. The Hospitality House has always been a little bit of a misfit group amongst the Alderson population. Shockingly, men with silly holes in their face and nonviolence tattoos all over their body are not the norm in Alderson, West Virginia. And so much of our work is with people who aren't from Alderson, West Virginia. This pandemic has really allowed that to change. I've run the Alderson food pantry for a lot of years. And this has changed how the food pantry is run. We do a lot of deliveries to people, whereas we didn't used to do that. And so again, just like the place to stay and the bed to sleep in was the excuse for people to have somebody to talk to during this pandemic, that has been what has brought me into connection with so many of my neighbors here in Alderson. Whether they're isolated just because they're the only one left alive in their family, or their kids have all left, or they're just very scared of this sickness, or that they've actually gotten sick. Me, delivering their food once a week or whatnot. Now that we're not delivering food anymore, I'll still stop by a lot of those places and just chat with the people that I haven't met in my decade here. And so the Lord can find a way to make an introvert into an extrovert as the Spirit moves, no matter what's going on. So it has been a neat opportunity for us to build and dig deeper roots into the community of our neighbors, since the community that is normal to the Hospitality House has not been able to come together.
Thank you so much. So before we hear from our last panelist, Wendy, a reminder, if you have any questions, go ahead and type that in the box. We might move to those after we hear from Wendy. So let's go ahead, not last, but certainly not least. Wendy Tuck.
Okay. I'm Wendy Tuck, and I'm in Parkersburg, West Virginia. We've been here 38 years, and when we moved to West Virginia, I was just telling Brian that in 73, 74, I was with Chuck Matheimer kind of looking around to find a house of hospitality for Alderson, because there were a number of women who were draft file burns, and they were housed at Alderson, and they needed a family to come stay with them. So it was just so exciting to meet you there. And I came into Peacemakers when I was 17, high school, and the Catholic Worker and Peacemakers were just traveling companions. So many of the things were values that were the same: resistance, the dignity of the poor, voluntary poverty. Some of those things were just, that personalism, where they're people. It's not like they're a client or a patient, and certainly living in different hospitality houses in Milwaukee and different places like that, you become you're just part of the family. So that was just a wonderful experience for me. And I still really have a lot of those. We live in, a pretty poor part of town, and we really moved here on purpose. We wanted to stay close to that. But we did give up some of we had kids. We just felt like we needed to accommodate family and kids' needs, so we didn't stay at a poverty level income. We bought sneakers and brand name clothes, and they played basketball or whatever. But I've been working with Birth to Three for the past 13, 14 years, and I've been executive director of a number of nonprofits. And I think with COVID, Well, certainly we couldn't do home visits, and so we had to do all of our visits virtually. And in my role, I'm a developmental specialist, so I am really not supposed to play with the kids, but you can't do that. But I mean, you just have to get down there and crawl around with them. But with COVID, I became much more of a coach, and much more a problem solver. Like, okay, your kid's not going to bed, so what do you think? Just more helping the parent, which is what we're supposed to be doing. And so actually in that way, it was great. It was much more empowering of the parents because they were the kids' teachers. They couldn't just say, hey, you're the expert, you do it, you fix them. And so that, I think that was a pretty good thing. But the craziest thing was the city council representative in our district kind of flipped his lid. He converted to a very, very, very extreme, radically conservative evangelical type church, and has just gotten bitterly, ugly, anti-gay, anti-trans, anti-black, anti-everything. And I decided to run for city council. And that was in February. And then the COVID struck. And it was like, oh, well, how do you run for an office when you can't go door to door and there's no public meetings? And you just had to get very creative. So some of the things the first thing I did was send out a survey to everybody in the neighborhood. I figured, well, the mailman goes everywhere. I can't, but he can, she can. And so we sent out a survey and said, hey, are you over 60? Do you have medical issues? Do you have somebody looking after you? Do you need some kind of help? And can you offer help? So we kind of had this matching game going, but we were able to put people together who either could offer a ride or needed a ride, or they wanted somebody just to call and make sure they were, okay. And that built up some pretty good friendships, like just simple. And I haven't been able to do the big ones. So if I'm out, I go walking about every day. And when I'm walking, I just figure I'm going to make the most of whatever conversation I have, so I probably haven't met a lot of people, but, the conversations have been much deeper and much longer, and I just feel like I've really gotten to know some people pretty well, and that's been very exciting. And I guess the other thing that I was doing is, I'm a good Samaritan. Like Dorothy was Works of Mercy, and I think that was the Catholic Worker brand, but I grew up Presbyterian, so we had the Good Samaritan. But it's kind of really similar, and that was my North Star. It was like, okay, I'm just going to pick everybody out of the ditch, and then you land in the ditch yourself. You go, wait, this is not the story. I'm not supposed to be here. And it led to just a really long, dark, what I thought was, just a spiritual crisis, and really struggled with faith and God and all that. And I tell you, the Catholic Worker, Dorothy, and people like Jeannie and Michael have really, kept that door open. So I'm extremely grateful to you both for that. When you're doing a lot of demonstrations, for instance, it's easy to get all riled up and yelling, and it just has always seemed kind of silly. I remember doing a demonstration against Oliver North, and we all went down with bologna sandwiches. and there was this line and this line, and we were just yeah. And I thought, well, this is dumb. So I went over to that line and started talking to somebody over there, and we ended up finding a whole lot in common about the works of mercy and loving your enemy, and actually found common ground. So I really delight in being able to do that. It seems like there was partly because of my work with children, I also deal with a lot of people who've experienced sexual abuse. And so it seemed like there just was a lot more in the news. You know, the Australians had a huge 5-year study on abuse in all kind of institutions. The Irish had it. Then the allegations of Larry Nassar came out, you know, the MSU doctor, and then there was Brett Kavanaugh, and I know I'm missing some, Weinstein, and all the Me Too, and I mean I mean, it was just like on and on and on, and you know, it seemed like it would come up as an issue and then die down, and it would come up again and die down, and actually that's again where I kind of reconnected with Michael, because all of that kind of led to dealing with Bishop Bransfield. And, you know, we came up with Jeannie and to have a presence at the cathedral in Wheeling. And so I really got to know them better again there. And another part of my community work there has been to do workshops or holidays for people who've experienced some kind of trauma. And so we had a Memorial Day for trauma survivors. We had a Solstice Art After Dark, where we used art as a medium to express just different things like that. So I guess I'm pretty hodgepodge. It's kind of whatever comes up in my neighborhood. I just deal with that. You know, it's probably not as specific as a house of hospitality or a medical clinic or a church, but you know, it's just who's across the street and who's next door and whose house burned down today, and you know, and making sure that people that are kind of left behind aren't. And I think that's my strongest reason for District 4 is it's a really, I think they put all the poor neighborhoods in one district. I think so. And I'm just determined that we shouldn't be forgotten like that. You know, there's a lot of things that could be done with city help, and there's good people. And I swear the best thing I ever learned from a Catholic worker was never underestimate people because of their income. Never, 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 never. And so, I mean, we've got fantastic people in this neighborhood, and you never blame them for the poverty. I mean, they've got, you know, all kind of problems, but it's not any lack. But city resources will help a lot. So that's kind of my goal, is to work on those things. Now, the oddest thing I think about the COVID here is there is so much resistance to wearing masks. People don't like to, and there's a lot of resistance to that. And the gentleman that I'm going to call him gentleman, who's my opponent, has been, you know, very, very vocal about not wearing a mask. And the other interesting thing is that we had a Black Lives Matter here, and he was actually on the street in camis with the AK-47 guarding the stores. And I guess this is the other part about Dorothy and the Catholic workers I really admire, is sometimes resistance is really scary. I mean, it just is. And I sometimes look at the people in Portland, and I mean, our police department just bought 52 gas masks. And it's like, Parkersburg, oh, what? And, but I just feel like the call of CCA, the call of the Catholic worker, is to be that presence in the middle of all that. And I don't know what's going to happen next, but I just really want to say, not here. You know, we're not going to have that kind of violence and hatred here if I can do anything about that. So
Thanks so much, Wendy. Yeah. This is great. I feel like I've learned a lot. We only have 15 minutes left. So again, if you have questions, feel free to write them. I had a few set up already. But looking specifically at the last few months with COVID, whichever one of the four of you would like to jump in, all or some, what are some of the joys that have come out of the challenges you faced in your work in ministry during the pandemic?
I think for me, you know, when you are finally able to see that patient in person and talk to them, and just to hear this, oh, it's so good to see you, you know, and that's a wonderful thing. And, you know, some of the solidarity, you know, and commiserating, you know, how are you? Oh, I'm doing as well as can be expected under all this nonsense, you know, you know, just doing things a little differently, but again, still being able to reach out and you know, comfort one another.
One of
For
the
us,
very unexpected things for me, I'm sorry, there was a lady in our neighborhood that is very, very, I mean, really believes that COVID is the apocalypse. I mean, really believes that, you know, this is it. And so she was very much in the favor of the other guy. But we had a lot of conversations, and now every time somebody questions or brings up anything about my faith or my positions, you know, she'll call me and ask me about it, you know, and I just feel like that kind of trust of someone who might normally not have anything to do with me has really become a very, you know, she gives me mint, but it's just more like the trust has been super, you know, to find those places of we're not that far apart, you know, I mean, in a funny way, you know, that's been a real joy to find those common places where you really enjoy each other regardless of your, you know, other beliefs.
The best thing about it for us is women getting sent home early from prison. Clearly, we are not on the same page when it comes to the prison industrial complex with the people who are running FPC Alderson. It's a minimum security camp. Nobody is there on a violent offense. And for the money that we as taxpayers are paying to lock these women up to do nothing for them or their families, they could be getting incredible help, whether they're there for addiction or this, that, or the other. And even if they aren't specifically needing help, if they were sentenced to home confinement, and perhaps if they are a white collar person who's embezzled a lot of money and that's why they're in trouble, hey, you're sentenced to doing 5 years of fundraising work for a little nonprofit called the Alderson Hospitality House or something like that. Restorative justice, right? That is actually trying to right wrongs and actually trying to recognize that there's two victims of crime, those who perpetrate it and those who it is acted upon. And this virus has led to more women being let out early on home confinement than we ever could have imagined. In the 10 years before this, while we've been here, there's been one compassionate release from FPC Alderson. Women die at FPC Alderson all the time. There's women at FPC Alderson that are doing decades for nonviolent drug offenses. And it's purely about punishment and about our nation being able to have an easy answer that the good guys are out of prison and the bad guys are in prison. Clearly, we recognize that it's far more complex than that. And it's taken a virus deadly enough that they just simply have to get as many people as possible out of prisons to have some of the women who never should have been there, or at least should not have been there for the amount of time that their sentences were, sent home. And so we've had a good number of our guests that thought they were going to be coming here for a decade more that have their loved one home now. And that is an incredible joy. And it's just difficult that it takes something, it takes something that all of us suffer from, right? Only those who are incarcerated and their families suffer from incarceration. So most Americans don't care about that. All Americans can suffer from this virus. And so the compassion that we can feel for each other then extends to those who are incarcerated, and folks in a system that previously did not have compassion did in this instance, and sent a lot of women home. And so that's been a joy.
I think for myself, as I, pastor, a parish, one of the things that, as I listened to the rest of us who spoke, I think the joy of the unknowing, that word comes to my mind and my heart, just the joy of unknowing, because I don't know, we don't know what comes next. We don't know day to day. I don't know if it's necessarily a joy, but I think it's more of a comfort. A couple of weeks ago, I had my very first COVID-19 anointing of the sick. And was I nervous? Yes, because I was going to go there. But I said, Lord, whatever you have in store, I'm going to go. And it's what I do, but it's more than just what I do. It's who I am, and it was to bring comfort to that family. And as I got all suited up, the medical personnel, the nurses there could not have been any more, compassionate and kind and just so embracing and welcoming. They gave me all of the gear that I had to wear in order to go into the ICU unit. And before going in, I was able to speak with the family, the two daughters. And one of the things that really drove this whole pandemic home to me, especially when people were saying, it's a hoax and all this kind of stuff. I even preached about it about a week ago or so. I got very, very fired up about it. Is that they were standing out in the hallway with their phone while I was inside the unit with the nurse, all of us, all suited up, and they were listening outside while I was with their loved one, doing the prayers and the anointing of the sick. So much so that when I finished, it really did take me talking about, as I said, I'm very much an extrovert. It really took me deep inside myself to find, that to kind of process it, but also to find that joy and that comfort in knowing that, even in this pandemic, the church, you and I, need to continue to be present to people. Quite honestly, we have a doctor. I have a doctorate, but it's not a medical doctor. But we have a doctor, a physician with us, and for me, I'm like, well, I don't know nothing about getting all suited up and all this kind of stuff, but they walked me through that, and so gave me an appreciation. So I think I don't just think it, I believe it is the joy, the comfort, and really an appreciation for life, for death, for sickness, for just that joy in a sense of unknowing, for whatever all that's worth.
Yeah, great, thank you. And we did have a question from the audience. So what changes or innovations that you've experienced in your work in ministry due to COVID would you like to see continue? So what's maybe a surprise good change in your routine or change in the way you've ministered to somebody that you want to continue or you would like to see your larger community continue?
I think
not having 50 people in our house every weekend's not really an option, right? But finding the space for quiet amidst the commotion has been easy. It's been easier during this pandemic than it has any time since my very short prison stay back in the day for civil disobedience. I had the time to be in scripture. I had the time for, contemplative silence. In my normal life, I didn't necessarily have that, both because of my work and we managed to bring two very extroverted children into the world. But during this pandemic, I have made that space. And I know for me, as a person doing service and doing justice in these crazy days, that silence and that contemplation that goes along with the service and the action is invaluable, and would love to continue carving that out.
I would concur with that, Brian. I definitely would concur with that for myself. I think for any of us, as people of service, people of the gospel. That's been one of the things because prior to coming here to All Saints in Bridgeport, I was in Morgantown at the University Parish, and it was very busy, go, go, go. I mean, handling so many different, juggling so many things, wonderful things. I mean, I'm quite blessed with everything that I had to that I was blessed to minister and serve the good people, there. However, I think we can get so caught up in that doing that for me, when I came here, and there was like, I didn't meet anybody other than a couple of staff in and out. The roads were quiet. I mean, I walked our property, and just kind of like the silence and the peace that brought. I thought, wow. And now I notice a little bit that now that we have so many like Zoom, because if you're on different committees and different things, you're always Zooming with different people and such. And then, we have mass every Sunday here, 2 masses on the weekend, 2 services. We see different, and it's like now it seems like things are picking up just a little bit. And I'm like, whoa, time out, let's kind of like hold off on this for a while, because I still want that peace, and that quiet, that solitude, if you will. And so I think that for myself, I would want to see, some of that solitude remain as I, continue on in ministry and service.
I think for us at the clinic,
Go ahead, Sharon. Go ahead.
I would love to see if we could continue to have available some sort of video visits. Unfortunately, the video has been difficult because so many of our people don't have the IT or the knowledge, on how to get into our portal so that they can have a video visit. The phone, we do mostly phone visits, and they're okay, we can do that when necessary. But I would like to see, us expand that ability to maybe sometimes do video visits for people who just genuinely do have a really hard time coming in, whether it be from infirmity or age or distance or whatever. And so I would like to see that be able to continue in some form.
I think for me, one of the best things I was doing really before COVID, between after Bransfield was, where are you, Jeannie? Coming down to retreat down at the Catholic Worker Farm down in Spencer. And, when COVID hit, it was like, I don't know if I can go anywhere. I mean, we didn't go anywhere. And I find that our house is really, we don't have 40 people, but I sometimes feel like my comings and goings might as well be. And about the only way I can center in and really drink deep is to get out of here. I got to go out of town. And, Jeannie's place down there has been a wonderful refuge where you just have time, to drink in and dig deep and just settle. It's just, there's just a lot going on here with these different things. So I think that I was trying to go every 2 months, just to consciously take that time to do that. So I'm hoping that will be something I can get back to, is to deliberately, as soon as the restrictions are over with that, we'll try that. It does help.
And so we're kind of close to time. I do have one more question that I think can be answered maybe in like a sentence or 2, just so we respect people if they have to leave. But before that, in the chat box, I just put the link to be able to see, I don't know why it didn't make it a web link, to see the rest of the workshops. So this one was really great. But if you would like to make sure that you don't miss out on any of the other workshops about restorative justice, dismantling white supremacy, this birthday celebration for CCA, and all other kind of really great things that are going to happen this month, definitely look at that website and make sure and come join us again for another workshop. But before we close out with our panelists and thank them, one last, maybe 1 or 2 sentence answer. What or who has been a source of support and comfort for you while working during this pandemic, while ministering?
Well, I think friends,
For
family,
myself,
coworkers. My church family.
I would say for me the same, like my little boys and my wife, of course. I've been in much more frequent contact with my parents, who are two of my best friends. And so just the like being intentional about communicating with people, that has been a source of comfort.
I think my husband, he lives in Charleston through the week and works down there and comes home on weekends. But I think we're treasuring our weekends more. I mean, he sometimes helps with campaign things, or we have a couple gardens going, and you know, we cook on Sunday so he can take food down to for the week. So that's been a real source of support and joy for me.
Our pig's pretty great too. Larry lives right under our front porch, and I just have time to sit on my front porch now. And the whole time I'm sitting out there, he's oinking at me, asking for food. So even though he thinks he's asking for food, he's clearly asking how my day was, wanting me to vent and get everything out so I can go back in the world and keep doing what I'm doing. So even a total jerk-faced potbelly pig can be a great source of comfort.
I would say for me, certainly my family, my friends, and I would say the staff here at my particular parish. We're all on the same wavelength. We can vent to one another, we can support one another, and they're present. We're present for each other, and I think that's important. I like that word, intentional. Friendships, intentional, speaking to individuals and people.
Well, I hope I speak for everyone that this was a really great first workshop for us to hear about all of you and all the people that you love deeply and care about. And hopefully it gives you, the rest of us, some motivation to keep doing what we're doing, to not be afraid to keep ministering in new ways during this pandemic. I don't think I have anything else. I don't know if Michael or Ed, if there's anything else you'd want to close with. Besides that, our next workshop is Thursday with Sister Beth Davies and Sister Kathy O'Hagan on addiction, their own struggles with addiction, as well as how they've ministered in Appalachia with people with an addiction over the last many, many years. So if you have questions about workshops, please don't be afraid to reach out to some CCA board members or Jeannie or Michael, or even on Facebook, and we can make sure we get you the links to join us. And please invite your friends as well. So thank you all. Have a good rest of your evening. And thank you all, Sharon and Walt and Brian and Wendy. It was really great.
Bye-bye.
Thank you all.
Thank you.
Thank you so much.
Bye.
Peace.